Last year, we had a very nice recorded message from Dr. Erica Scavella, the VA's Assistant Undersecretary for Health for Clinical Services. This year, we have an Undersecretary in the house. So, I want to thank the Phoenix VA Director Matthews and Deputy Executive Director Michael Welsh, who requested to have Undersecretary Clancy come to speak with us. We are very grateful. So I'd like to introduce Dr. Carolyn Clancy, Assistant Undersecretary for Health, Office of Discovery, Education, and Affiliate Networks. Dr. Clancy has served in a variety of positions across the VA and received numerous awards, including being selected as the 2015 Outstanding Federal Executive of the Year by the Disabled American Veterans. I like that one. I'm going to say this, but I'm going to say this because I mean this. More importantly, she knows one of our Be Connected program founders, Dr. Maureen McCarthy, who just retired from the VA. So we quickly bonded over her awesomenitude and her Irish soda bread, by the way, awesome. To me, anyone who is both brought in by the Phoenix VA to speak and who is friends with Maureen and loves Irish soda bread is good people. So please join me in welcoming Undersecretary Clancy.
Well, good morning, everyone. I told Thomas earlier that I'm learning a lot about opening a meeting. You get everybody, engaged and energized right up front. And I do want to say I never, ever miss a chance to point out that I went to the same medical school as Maureen McCarthy. So just really thank you, Thomas, for a wonderful introduction. He and I spoke by Zoom or something about 10 days ago, and he got me really excited about this meeting. So I am very excited to be here. But when I saw him this morning, I said, wow, I thought you looked pretty great on the screen, but really much, much better in person. So he wanted me to say that to all of you. On behalf of Secretary McDonough and our entire senior leadership, I want to extend our profound gratitude to the Arizona Coalition for Military Families and the many veterans and representatives from community groups, nonprofits, and civic organizations here with us today. And I have to shout out my colleagues here from the Veterans Health Administration. Brian Matthews, the director of the Phoenix VA. You can stand right up, Brian. Michael Welch, the Deputy Executive Director, if he's here. He's working. Working, okay. Steve Sample, who actually worked for me briefly when I first came to VA, Director of the Northern Arizona VA. Jennifer Gutowski, Director of the Southern Arizona VA Healthcare System. We've had a number of adventures together in that tropical paradise known as Hawaii, and that's all I'm going to say about it. And Chris Norton, the Director of the Phoenix Regional Benefits Office. Thank you all for that you do for veterans. Today, I want to focus and just build on Tom's message about the critical importance of community partnerships and capacity building, especially as it pertains to suicide prevention. I want to give you a sense of how much we encourage and know that we desperately need these partnerships. VA cannot do it alone. We have a lot of resources, we have dedication, we have teammates who are unbelievably passionate about our mission. You can't buy that. It's just amazing and that's part of my why of working for VA. But we desperately need people on the ground who can help us make sure and bring it home for the veterans we're serving. So I don't know how many of you have heard the name Atul Gawande. It's kind of a mouthful, but a brilliant surgeon and writer currently working for the State Department and the Agency for International Development. But he's also written for the New Yorker over the years. Probably known to some people for writing an article about healthcare where he compared it to the Cheesecake Factory. Now, I thought this was a pretty brilliant article. Other people thought this was the most appalling example. They are not nutritious at all. This might have been before Skinnylicious and so forth, but But what he once said was, if you want to go quickly, go alone. And if you want to go fast, if you want to go far, you go together. The ACMF has taken that to heart, and have you gone far working with community partners to prevent veteran suicide? Your Be Connected program, wow. Talk about a best practice to connect veterans. And I hadn't heard the story till this morning, Thomas, about all of the individual pieces for that one veteran. But it's no wonder at all that you have been recognized as being a beautiful collaboration. We cannot do this work without you. Really, really important. First, this was one of the winners of our 2018 National VHA, that's Veterans Health Administration, Community Partnership Challenge. I love this celebration every year because what you end up seeing is people who are utterly brilliant, but I mean, they are heads down working on research, really dedicating a lot of awe and admiration for their partners who are taking that work and making it happen for veterans. That is what makes VA special, but having partners on the ground actually makes it work. So we have an office called the National Center for Healthcare Advancement and Partnerships, another mouthful, but essentially it makes it easy for our facilities. They don't have to reinvent an MOU or whatever it is you need to just kind of say there's goodwill on both sides and we want to do great things for veterans. Of course, there's a little more legal terminology than that thrown in, but you know, their job is just to make it faster. I do remember, if I'm correct, that this program was also recognized at the White House signing of the executive order on Prevents, an acronym that I will never, ever be able to, I always have to look at my notes. I didn't bring any today. Third, it reminds me of something a dear friend and truly inspiring health policy leader who did log a lot of time here in the Public Health Service in Arizona, as it turns out. But he once observed this after he retired from government and was seeing patients at a local community health center. His name was Fitzhugh Mullen, and reflecting on his time in government, he said, you know, when I worked in government, I took enormous pride every day in coming to work, thinking that my team and I were throwing lifelines to people in need. I mean, that's a great feeling to have. He said, but you know, at the water's edge, where I'm seeing people in a safety net clinic now, I get to see how often those lifelines get tangled. That's what all of you do, is to make sure that the right line gets to the right veteran for the right purpose. Just listening to you earlier, Thomas, tick off all of the different services. All of those services are great, but if they're not integrated and connected to the right person, it's great intentions that miss the mark. So again, thank you from the bottom of my heart. So be connected in addressing the seemingly small yet highly critical needs of veterans. Who is going to forget that picture, even if there was a heart instead of the expression, right, of the little girl, I'm assuming a girl, with Ritz crackers. Wow. Ritz crackers are making a comeback, I understand as well. But actually helping veterans get the health care they need, matching the right resources to reach a veteran's unique family or personal situation, take transportation, right? This program reserved rides through the end of the year for an elderly veteran who lives alone and is losing his eyesight. While independent, he's needed assistance with regular VA appointments when he can't utilize disabled American veterans' transportation resources. Because of Be Connected, he can continue to be independent at home. Who doesn't want that? In another case, a Be Connected navigator assisted a veteran who didn't have the money to pay for a dentist and didn't qualify for dental care through VA. The navigator located resources with the Be Connected network and dentistry schools in the veterans area, doing low to no cost procedures, helping the veteran keep dental health a priority, a very big problem. I understand there are thousands more of these stories, and I am committing to you right now that I am not going to be reading all of them off. But this is what you all have made happen, which is just inspiring every day. So what Tom doesn't know was the Friday we had a conversation, you know, by computer. You know, for the rest of the day, I kind of had trouble paying attention. I simulated activity, but I was just listening to him talk about this coalition had really, really made my week. And that's what we're trying to continue to do at the enterprise level at VA. So anything that we can do as a department to make your work easier, we need to hear about it because we very much want to be part of the solution. Suicide prevention, just to focus on that for a few minutes, has always been our top clinical priority, and it's also one of our current Undersecretary for Health's 6 priorities. It's part of our national strategy for preventing veteran suicide and the Biden-Harris's team's relentless focus on reducing military and veteran suicide. Last year, we released our national 22 veteran suicide report, and unfortunately, the most recent year that we have is not so great, and it's particularly not so great for women. We don't really know what that's about. More women are using firearms when they make that decision. But it does say to us, we haven't done enough and we have to keep going. Any veteran death by suicide is one too many. For those of you like me who have had immediate families impacted, it's not the same ever again. And if you think about the ripple effects when we lose people who have given so much to this country, it's just heartbreaking. So a couple of years ago, we just said, you know, we have all these great approaches and strategies and research, but maybe we need some out-of-the-box thinking. So we launched something called Mission Daybreak. Now, we have utterly brilliant people focused on mental health and suicide prevention, and I have a team focused on innovation. They are truly crazy and wildly energetic, and there's, you know, they don't know about thinking outside the box because no one told them about the box, right? But the idea was to actually just put a broad announcement out there that says, give us your ideas no matter how crazy they are. More than 1,300 submissions came in, and ultimately this was narrowed down to 30 finalists and 10 absolute winners, focused on everything from lethal means safety to trying to figure out, can we predict from people's online behavior what kind of risk they are at ahead of time? Can we identify risks further upstream? Of course we need a crisis line at 988. Those are utterly vital. But can we actually catch people sooner than that? The work that you do gives me enormous optimism that, yes, we can actually get there. As I mentioned, we also have a center that leverages partnerships and novel approaches. And one of these programs that they sponsor is the Veteran Sponsorship Initiative. And this is a public health approach, right? This is, everybody's on this team. And similar to the Be Connected program, its goal is to focus upstream, right? Not at the moment of crisis. Of course, that's important. I'm not discounting that. But to really identify people much, much earlier in the process. So we are pulling out all of the stops that we possibly can. And here in this network, which we know of as Vision 22, there are 2 of these partnerships, one with the LA County Department of Military and Veterans Affairs, and the other with the San Diego Veterans Coalition. So it brings new meaning to the idea of a team sport as the work that you all do together does. I'm really, really excited that ACMF is already collaborating with a VSPN nonprofit organization, the ETS sponsorship program, to leverage VA-trained peer sponsors and provide proactive support to newly transitioned veterans. Really just a vital period of time. I want to mention emerging technologies. And I don't mean the iPhone 15, right? What I am talking about is artificial intelligence. Now, artificial intelligence is really great because I'm quite confident I could get on the bus. I haven't tried this in a plane yet, but I might tonight. And just say AI, and I'd have a small crowd around me. Maybe not such a great idea on a plane, right? Everyone is like all jazzed about it, and what does this mean? And is that what they used when they made Harrison Ford look younger in this movie? Yes, it is, and so forth. But it's going to help us to weigh different kinds of data analyses, again, that might give us some upstream downstream signals about where we can intervene with precision. And we use it in a model to predict the veterans enrolled in our system. The model is called ReachVet, and we can identify the veterans at highest risk. Now, what we are looking at is their behavior in our system, right? So it doesn't help us with veterans who aren't enrolled in VA healthcare, but we'll get there too. I'm quite confident about that. And we're also using something called virtual reality. How many of you know what I mean when I'm talking about virtual reality? Oh, good, a lot of hands. My husband keeps asking me to define it, but that's another story. Sometimes called augmented reality or simulation or immersive technology. This is something that's growing like wildfire, and it's very organic within VA. Kind of started a little before the pandemic, and then when we couldn't see veterans, those tools became even more powerful. If you are interested in learning more, out here in the exhibit hall, if you walk out the door and go to the right at the end, a couple of our people are here with headsets. The headsets look funky, but they're really helping a lot of veterans. I spoke with a veteran not too long ago with chronic phantom limb pain, if you all know what I'm referring to. Horrible pain. Nothing we have for pain helps very much with this. And when he was asked, was this helping, he said he wasn't sure right at the start, but after about a week, he realized he wasn't afraid to go to bed at night, which is when the pain was always the worst. So there's no stop that we won't pull out. And working with you and a coalition this successful, there's no way we can miss, at least for the veterans and people who've served. So I very, very much want to thank you as you listen for all of the work that you do. And as you listen to the outstanding speakers and discussions today and tomorrow, I know that you're going to hear, everyone here will hear something that inspires them that they didn't know about before, which is why Thomas wanted us to introduce ourselves to someone we didn't know. To paraphrase Dr. Gawande's quote, by working together, we can go even further, improving veterans' mental health and preventing veteran suicide. Thank you again for inviting me today. It is truly an honor to be in your presence, and I know this will be a wonderful symposium.